Welcome back to Clarkston Lighthouse Guidance. My name's Chandler Fleming. I'm the owner and lead therapist at Clarkston Lighthouse Counseling.
And I am Victoria Fleming, owner and therapist at Clarkston Lighthouse Counseling. Welcome to our show today. Today we are answering some audience posed questions. So I'm going to read the question and then we have our expert Chandler and some help from me, Victoria, in answering them. So question number 1. I was sitting in my living room and started to think that I was dying. My heart was racing. I was sweating. I could hardly breathe. Am I going crazy? Will this happen again? Am I dying?
You know, I think she did an awesome job in reading that question, by the way. Lots of inflection. I really like that part. So obviously this person is having a panic attack, or it seems pretty probable they're having a panic attack. And with panic attacks just in general, you do want to rule it out. Some people actually do have a heart attack and don't go to the hospital. But for the most part, you've been to the hospital before. You know, kind of depends on your age. If you're 20 years old, the likelihood of having a heart attack is probably pretty low. So it's probably a panic. Obviously you were alive enough to write the question and send it in. So thank you very much. So what do we know about panic attacks?
We know that panic attacks can happen really kind of out of the blue. Sometimes people are not able to recognize that it is a panic attack because there was not necessarily an immediate trigger. There wasn't something that immediately caused them to think, okay, this was really intense and now I'm having a panic attack. Again, want to emphasize, do rule out that it is not a heart attack. That is super important. But just based on what you're saying, there is a very good likelihood that it is a panic attack. And with the panic attack, the symptoms that you listed are very common. The shortness of breath, the difficulty breathing, the heart racing, sweating, and it can be pretty intense and pretty scary. What are some ways a person can cope with that?
Well, one thing is just recognizing, hey, this is a panic attack. And when people label it as a panic attack, they tend to do a lot better. It's really redefining the symptoms. So we know that our heart's a muscle. So if you're having a panic attack and your heart is racing, it's kind of like running a mile. It's good for your heart. It's getting wonderful exercise.
Now that is super hard. I appreciate you saying that. But in the midst of it, so you're saying if a person can recognize, whoa, this is actually really good exercise for my heart, then that can actually help them to overcome the stress of it. Okay.
And just saying, hey, this is just a panic attack. Recognizing that most panic attacks really are only severe for about 10 or 15 minutes and then they go away. You may have another one after that, but the vast majority of panic attacks are time limited. And so then the other thing is, if you do have another one or they continue, working with a counselor and so forth, but it's recognizing the control that you have. So one of the things, and people look at me like, I don't know what I'm talking about, but I'll say to them, you know what, the next time it comes on, I want you to make it worse. Well, how can I make it worse? Stand up and spin around. So not only are you having a panic attack, you're dizzy and having a panic attack. And what it does is it does teach people the level of control that they have. I've had people in the office try to recreate a panic attack. And when they do, it's really, really beneficial. Ultimately, most people learn how to manage them and they go away.
What I appreciate about what you're saying too is it is time limited.
Yep.
I've often compared it to being caught up in a wave in the ocean. You get pummeled by it. It's pretty scary at first, but you have to tell yourself, this is going to pass. I'm going to get spit out on shore and I may be okay. Reframing it, like you said, hey, this is good exercise for my heart. And then 3, like you said, recognizing the control that we do have. So,
and the last thing about them too, is just remember the number one cause of a panic attack is a fear of a panic attack. So once you have one, sometimes you set yourself up for the next one in trying to chill out, relax, and say, you know what, I probably won't. A lot of people just have 1 or 2 and they go away because they recognize what they are. But all we have to fear is fear itself. And how do we avoid that? We look at it, play it out, and recognize they're very survivable.
Diffuse the situation.
Yep.
So question number 2. My husband and I went to his 25th class reunion where he started talking to his ex-girlfriend from high school. Since then, they have been texting a couple of times a week. He tells me about texting her, but seems to be hiding his phone. When I told him that I wanted to be copied in on the text, he called me crazy and said that he was angry that I did not trust him. Am I being jealous? Am I crazy? Our bedroom time has been even more passionate and he still tells me that he loves me. Overly? Question mark? concerned wife?
Yeah, this one's a toughie. It's a toughie in part because people, one, overestimate their ability to overcome temptation. So lots and lots of people believe, hey, we're just good friends, nothing's going to happen. And that ignores the facts. And the facts are that lots and lots of people have affairs. And about 85%, we believe, of those people who are having affairs are not bad people who are looking for it. It starts off with a friendship and it just gets more and more intimate over time, and the intimacy leads to crossing lines.
So the wife is not crazy in having these feelings of concern and this prompting of jealousy.
Right. So she's not crazy at all, but there's two fundamental issues. And one of those issues is we want to believe that we're fully trusted, but none of us are fully trustworthy. And it's sort of like a lady that I worked with, and I said to her, would you allow your teenage daughter to go upstairs and lay in bed with her boyfriend? And she goes, that just wouldn't be smart. I said, well, don't you trust her? Well, she's a good girl. I trust her, sort of, but it just wouldn't be smart. And I have that message for most people. Recognize that we have limitations, and that oftentimes it's just not smart. I think it's funny, but I strongly recommend people go to YouTube and watch When Harry Met Sally.
Sally, absolutely. It's a great little dialogue.
Yeah. Can men and women just be friends? And there's a lot of wisdom in that.
Because Harry's saying no, they cannot.
Right.
He's saying that a man cannot be friends with a woman because ultimately he really wants to spend intimate time with her in the long run. So it's just a really funny clip, but I think it does point out the fact that it's a slippery slope.
It's a slippery
What starts out as innocent. So, to the wife that's concerned, there is reason for your concern. You're not crazy, and there do need to be some very healthy boundaries.
Right. In boundaries, but also in order to maintain a happy relationship and a healthy relationship, lots of transparency. Secrets destroy relationships. And if you are afraid to show your spouse, then maybe that's a sign that what's going on is something that is a little bit too provocative to be sharing.
And the other thing is there's an addicting factor to secrets because it makes it more, just more exciting.
Oh yeah.
Definitely. So yeah,
Mystifies
absolutely. Mystifies it all. So healthy boundaries, respectful communication between the two of you, but yeah, you're not crazy and there is some reason to be concerned.
And there's something to be said about healthy jealousy. We should be protective of our relationships, and because people innocently walk down that path and develop a friendship with somebody that leads to something else, oftentimes they do need our help, even if it makes them angry.
But I appreciate what you said, healthy jealousy.
Right.
So, yeah, healthy jealousy. And that's a fine line to walk, but just expressing I'm concerned.
Oh, sure.
So, all right, so question number 3. My son is a great kid, but lately he's been acting strangely. He's refusing to wear deodorant, and when I asked him to wash the windows in his room, he used a paper towel and water. When I told him to use glass cleaner, he refused and told me to do it. This is out of character for him. What is going on? Confused parent. What say you, Chandler?
Gosh, it's hard to tell based on the question, but my best guess would be that this kid is suffering from obsessive compulsive disorder, and he has these fears of like a chemical contamination. So this definitely can be OCD.
Okay, but wait a minute. His room may be a mess. How can that be OCD?
Well, sometimes obsessive compulsive disorder just kind of latches onto a specific area, and frequently it does.
And it's differentiated from the personality disorder, which is more characterized with that neatness and having to have everything in order.
Right. So there's definitely an overlap between obsessive compulsive personality disorder and obsessive compulsive disorder. And in the personality disorder, it's more of a character thing. They tend to be finicky, and they tend to be need to have things neatly and in order, but it really doesn't. It's really not an anxiety disorder. It's just kind of their personality.
Okay. Whereas with obsessive compulsive disorder, we're looking at it's more of an anxiety based.
Yeah, it's anxiety. It is an anxiety disorder, and what works best for this is really just slow exposure. Exposure is you get the kid to touch the bottle of Windex for a while, and then after a while you get to spray a little bit on his hand, and that those exposures over time helps them gain control over their disorder. It helps them out a bunch.
Yeah, so very likely what could have happened is just that your teenager is at a place where he's feeling out of control in some other areas, the anxiety is increased, and now his mind has fixated on this particular area with the chemicals, and he's just seeking a way to find some control. And as Chandler said, it's that exposure and helping him recognize this is not a reasonable concern to have.
Right. In both, as we talked about panic disorder and obsessive compulsive disorder, they respond well to high doses of antidepressants. So sometimes talking therapy isn't enough to kind of get them over the hurdle, but non-addicting antidepressants work really, really well with this. It's usually more than the starting dose, and that's where I see people, when they go to the family doctor, they kind of go low and slow, and it's too slow and too low for them to get better. But when you go see a psychiatrist, a lot of times they up those dosages and all the symptoms go away.
So would you start with going to the family doctor, or would you start with talk therapy?
Yeah, I would start with talk therapy because, a lot of people do respond to the talk therapy, and, there are side effects to just about everything. I mean, there's side effects to coffee, but also side effects to medication. So I would start off, and see how talk therapy works, and if you're not having success, then integrate in some medication.
Okay, so super helpful on that. All right, so we have got another question. This is question, I believe, number 4. At work, we are often asked to give a 1-minute report. Most people take about a minute, but some people take up to 5 minutes, even when others are given signs of time's up. This irritates me. Why do they behave that way? Why does it bother me? Respect my time, would ya?
Yeah, I can understand this person's frustration. But the reality is those why questions are tough. Why people do things is a real difficult question to answer. There's usually multiple factors involved in it, so it's usually not just one thing.
I mean, it could be the person's nervous. I know that sometimes when people get nervous, it's almost like they over-talk it and don't even recognize that so much time has come up, that they've used their time. But there's also that flip side where it could be, I'm so important and what I have to say is so important that I deserve more time.
Right. And we all break rules, but it's kind of, what is the threshold for breaking a rule? You know what? If my wife was dying and needed to go to the hospital, I might run a few red lights.
Good point.
Because I'm breaking a rule, but I think it's justified. But some people, they kind of gauge themselves more important than rules. And why does it bother us? That can be pretty frustrating. It's kind of a infringement on our rights, and we have expectations that people will obey those rules, that people will do what they're supposed to do. And some people, you got to look at yourself. Are you overly a rule person?
But I appreciate what you said, that one, we cannot necessarily know the why the person is breaking the time limit. And understandably why it would frustrate us, but I may be breaking rules in other places, just as you pointed out. Put me at a turn signal and the person in the front is, for whatever reason, maybe checking their phone or taking forever, and I know if you don't use those first few seconds, I'm never going to get through. I feel highly frustrated.
Sure.
But I don't know what's going on with them.
And we all have different thresholds of frustration. I do think people have to work on self-soothing. So when you are frustrated, what do you do to relieve stress? So sometimes you can make a fun game out of it. You can time and guess how many seconds you think they'll talk.
If it's one of the talkers, you can do the prediction game. This time I think Larry's going to take 4.35 and time it. And then that way it's a distraction, and it actually becomes kind of a funny game instead of being so focused on, oh my gosh, he's at 3.5 already. So self-soothing, and I think just distraction
really
is a super
distraction
important.
is a way of self-soothing too.
Yeah, absolutely. So self-soothing, I think, is a great way for you to be able to help deal with it, because the reality is my huffing and puffing's not going to make the person in front drive faster, and it's very possible that your drumming of the fingers isn't going to change how fast the person talks either. So work on some self-soothing.
And remember your magic twos. Magic twos are really important. Is it going to matter in 2 minutes? minutes, 2 hours, 2 days. And a lot of things that we allow our frustration level get way too high on don't matter in 2 minutes. 2 minutes later, it's all good.
Especially 2 hours later, not going to matter, meeting's over.
Yep.
So move on, next thing, right?
Yep.
So, okay, thank you so much for that question. Now for the next question. My neighbor's son is totally out of control. He stole the car. He puts holes in the wall. He's only 14. His parents say they have tried everything and he does not respond to discipline. They appear to be afraid of him. Is he bipolar? Can he be helped? Living next to Mr. Manson?
Good questions. I've worked with a lot of kids this way, and it's very hard based on that information to know, is this kid bipolar or not? Probably not, but it's hard to tell. That could be a contributing factor. I always find these questions somewhat humorous because it reminds me of a lot of clients I see. So mom and dad will come in and they'll say, we've tried everything, and they don't respond to discipline. And so when I explore that with them, I tend not to believe them.
Especially not the everything.
Yeah, and then the kid comes into the room and he's wearing his new Nike tennis shoes, and he's got a brand new phone and earbuds and the whole 9 yards. And so there's definitely parents oftentimes give up before they really discipline hard enough and long enough.
And sometimes it's that lack of consistency. They may try something for a short time, but not have tried it long enough or consistently enough for there to be the reward that they're looking for.
Yep.
What are some of the concerns here, though? Because 14, if at 18 he moves out, that could be 4 really long years. So what do we suggest to these parents? I mean, one, I would say get help.
Well, one is definitely get help, but two is not accepting the fact that they don't respond to discipline, because that's hugely dangerous. And it's like saying, my kid just walks into traffic. No matter what I decide to do, he just does it. Well, you can't accept that. You have to have a battle plan, and you have to get help. So that sometimes it's more specialized treatment, sometimes it's counseling, sometimes it's boot camp or alternative school, but you can't just say, well, he doesn't respond to discipline, I'm going to quit disciplining.
So really the first step is with the parents. The parents need to reevaluate, go back to the basics.
Right.
And that's very often what does need to happen, is there is a going back to the basics of working with some of the basic discipline of clean your room and do what we say.
It's picking your battles wisely, and a kid that's putting holes in the walls and stealing the car, you might not start with the basics of clean your room, but you may start with the basics of what behaviors are you rewarding, what discipline can I use, what's the next harshest discipline. Sometimes you give things to be able to take them away. So
like the phone.
Like the phone
that he walked in with and the wireless earbuds.
So, and one of the things that happens in this, there's a guilt cycle that takes place. Parents oftentimes ask themselves, is it my fault? And sometimes they believe it's their fault because they did something wrong in their opinion, or it's their fault because they haven't been able to solve the issue. I really don't care whose fault it is, but I do say that it is your responsibility to fix this.
Okay, so then the question becomes, though, because this is actually the neighbor who's asking the question, and it sounds like maybe the neighbor's concerned for his or her safety. Because really we're addressing more the parent and the child.
Sure.
What about the neighbor?
It's hard, because if the kid's not listening to his parents, he's not going to listen to the neighbor. Are they at higher risk? Most certainly. Somebody who's stealing a car and putting holes in the walls, sure, they're more likely to break into your house. Behavior tends to there are predictors, and bad behavior predicts more bad behavior.
Right.
How much of a realistic risk it is? Most kids don't hurt their neighbors.
Right.
Most kids don't, kill their neighbors. There are exceptions. They're rare exceptions.
Very rare exceptions.
But there are exceptions.
And it could be more of an issue where it is a teenager having a struggle with his parents, where he's angry at his parents, but he's not angry at the neighbor at all.
Yep.
Because they're not the ones actually living together. So is there risk? Sure, absolutely. Observe what's going on, have healthy boundaries. But the reality is it's probably more connected to home, and hopefully the parents are going to be able to provide some discipline that will be effective.
Yep.
So,
For sure.
any further comments on that one?
The only one is that encourage the neighbor to get help. that if the first counselor doesn't work, or there are other options out there.
Yeah, especially if they have a relationship.
Sure.
You know, hey, I'm concerned. You guys okay?
Yep. So those are all our questions, and I really appreciate the people that we provided. Obviously, we changed the names to protect the innocent and the guilty alike.
And the names were meant to be humorous, so no offense in any way intended.
Right. So the names are supposed to be humorous. But thank you so much for sending in your questions, and look forward to meeting with you again.
Yeah, and we would actually love some more questions.
Yes.
This was a lot of fun for us to be able to go through them and to just come up with some reasonable information for the limited. We have limited information on these questions. You know,
Sure.
we don't necessarily know all the details, but do hope that we've given you a general framework that's been helpful. So please, by all means, look for the information at the end of the show where you can contact us and send us more questions that we can do a You Asked. Thank you so much for joining us. Have a wonderful day.
Have a great day.
The views expressed in this show are for general educational purposes only and do not constitute professional advice on any subject matter, nor do they necessarily reflect the views or opinions of its guests or of Independence Television. If mental health assistance is needed, please seek professional licensed treatment.